Very much. Thanks for the opportunity to speak with you. Hello, my name is Jeffery Mann. I'm a practicing orthopedic surgeon. I work in Oakland and Berkeley at a place called California Sports and Orthopedic Institute. I'm going to discuss climate change and why I consider it a public health emergency. So these are a couple of slides I was asked to present. I do not have any financial relationships or commercial interests, so I can let you read those parts. And these are the learning objectives to explain the impacts of climate change on human health and the practice of medicine, to identify populations most at risk of negative health impacts of climate change, to integrate climate change into your framework for practicing, teaching, and talking about medicine. So of course, what's a talk about climate change if there isn't a polar bear on an iceberg? So, and I'm just using this slide to illustrate sort of what I'm not talking about, which is the causes of climate change. How long do we have to stop climate change? How hot it's going to get by the end of the century? Those kind of questions. Those are all critically important, but that isn't what I'm talking about. And I'm happy to point you in the direction of the answers to those if anybody wants. So what I am going to be discussing is that what we as physicians are going to see in our patients as a result of climate change. And the greatest impacts that we're going to see have to do with heat illness, poor air quality, vector-borne illnesses, and natural disasters. I'm also going to cover how climate change aggravates pre-existing health inequity. So the second part of the talk, I'm going to discuss effective ways we can use our healthcare voices to advocate for our patients and for the environment. And I'm going to look at the climate policies recommended by our local, regional, and national medical associations. I also want to share some environmental issues in our community that you may or may not be aware of that we have been advocating for. And I'm going to introduce a couple of the groups that I'm involved with that have been doing this kind of work. I also want to conclude with a solution that can save lives and the health of our environment, and it is available right now. First, however, I want to formally thank the frontline healthcare providers. That's all of you for protecting all of us during the pandemic. Our entire community owes you a tremendous debt of gratitude. And that's our local community and nationwide. So I very, very heartfelt thank you. So how did I get from fixing broken bones to advocating for the environment, writing opinion pieces for local papers? So I've always loved the outdoors. My family's visited national parks. We go to national parks on every vacation. I go backpacking every summer. And as climate change became recognized as a major environmental threat, I read this book that I have on the right, which is called The Uninhabitable Earth. And this spelled out in great detail what the future was going to look like with varying degrees of warming, including the amount of inevitable warming that's already baked in. So then these future predictions started to become a reality all around me in my lifetime. And I realized at that point that I needed to do more for the environment than just drive an electric vehicle and avoid eating red meat, that it was really critical that more had to be done. Now, it just also happened at this time, which was about the fall of 2019, that I was introduced to a new climate group that had been recently formed called Climate Health Now, and I'll talk a little bit more about that later. And this seemed to be a perfect combination of my desire to do something much more to do what I could for climate change, and also using my health voice and our health voices to speak out against climate change. So I came to this realization just a couple of years ago, but the impact of climate change on human health was recognized over 30 years ago. This is from the New England Journal of Medicine in 1989. And this was from the World Health Organization. And they looked at the potential health effects of global climatic and environmental changes. This was over 30 years ago. And it really wasn't until a number of years later, sorry, I'll get to that in just a minute. So And this slide illustrates the most significant climate change impacts on health. So I didn't put that slide together, so I'm not going to take any. So it's a great slide. I was able to borrow that from somewhere. So, but these are all the impacts of climate change. So I'm not going to talk about all these. I'm going to really focus on these four right here, which are extreme heat, severe weather, air pollution, and changes in vector ecology. So these graphs point out that the geographical areas experiencing extreme temperature events in the Northern Hemisphere are just increasing dramatically. So this is sort of the area under the curve that we're going to look at. So this was up until 1980, and this was sort of where the average temperatures were. And really almost no temperatures were found, or no areas were found that had the temperatures in this area, which is over 3 standard deviations above the normal. So, and you can see how this shifts, and what that is showing is that by this last decade, going from 0.1% of the land, and now 22% of the land in the Northern Hemisphere has areas that experience potential life-threatening heat. So again, going from almost nothing to 22% has areas of life-threatening heat. So there are so many different graphs and different ways that show how temperatures increase, but I think this one is really quite dramatic. So heat is actually the leading cause of weather-related deaths. An estimated 12,000 Americans die of heat-related causes annually. This is a number that's comparable to the annual deaths from gun homicides. The number of people experiencing extreme heat globally increased by 125 million over this time period, 2000-2016. And what this shows is since 1980, and really in the past 10 years, the planet has experienced a 50 times increase in the number of dangerous heat waves. So remember snow days? Today's kids get heat days. Schools have to close because they can't keep the kids cool enough. So what effects do we see as practitioners? So this is a study from the Journal of Epidemiology, and this found that for every degree Celsius above 32 degrees, and that's about 90 degrees Fahrenheit, this is associated with a 3% increase in hospitalizations for respiratory disease. And again, this is for every 1 degree. So, you know, this is 3% for every 1 degree above that. This is an increase by 6% for Hispanic persons, and by 5% increase for the elderly. We also see increases in cardiovascular disease, including ischemic heart disease and cardiac dysrhythmias. Some additional health effects of extreme heat is on the kidneys. So this exacerbates underlying renal disease and can lead to acute renal disease. There are several studies on Central American agricultural workers, and these studies showed that 15 to 40% had chronic kidney disease, and these were sometimes very young people, and this is thought to be due to chronic heat exposure. Heat causes pregnancy complications, and as this graph shows, as the temperature gets hotter, homicides, assaults, and accidental trauma increases dramatically. So which population groups are most affected by extreme heat? Well, especially the elderly. They're most susceptible to dehydration, stress. They're less able to sense heat or sweat, less able to feel thirst. And older bodies don't regulate internal heat as well. Children are more affected, pregnant women, those with underlying chronic disease, those with mental illness, living alone or homeless. The impact of heat stress on outdoor workers is clearly underappreciated. These are numerous studies, and this is just a partial list from where I got these. But especially outdoor workers are prone to heat stress and stroke, dehydration, kidney disease, and air pollution. And some of the reasons behind that, these are a few facts that in order to cool down, you can really only absorb 1 liter an hour of water if you're drinking. So you can see how easy it is to get dehydrated if you're outside working in hot weather. And sweating is no longer effective when the relative humidity exceeds 75%. And then, a lot of outdoor workers have protective clothing, and this clearly reduces their ability to sweat and therefore regulate their heat. There is a phenomenon known as heat islands. And so heat islands, do you need to get some? Okay, so urban heat islands. So these are areas in the middle of the city, and they are laden with concrete, and they have little greenery, and they retain more heat up to 3 to 5 degrees Celsius. So that's up to 10 degrees Fahrenheit than surrounding areas. This study, which just came out a few weeks ago, showed that people of color were more exposed to heat islands in essentially every urban area in the United States. These heat islands have hotter days, and there's less nighttime cooling. So even at night, you just can't cool off from this heat. It's just unrelenting. And they have higher air pollution. So, and these conditions can contribute to heat-related deaths and illnesses such as stroke, respiratory difficulty, and of course, heat stroke. Going from heat to the health impacts of poor air quality. And this is an area, as you'll see from some of the studies, that has really become an important area that has been studied all over the world. And the effects of poor air quality have become, much more known and studying. And it's really dramatic, the effect that they are having on the health of the entire world. So let's talk about air pollution. Air pollution is smog and soot. So what's smog? Smog is the dirty air, or the ozone, and soot is the particulate matter. So particulate matter, or PM, especially these smallest ones, the PM 2.5. So this is sort of an illustration. This is a human hair, and you can see how small those particulate matters are. So PM 2.5s, they are the main cause of the health impacts from air pollution. The reason why they're so dangerous is because they get absorbed directly into the bloodstream, and they don't get filtered out by the lungs. So again, air pollution, soot and smog. So ozone, let's talk about ozone for a minute. That's the soot part. So there's two types of ozone. There's actually high level ozone, and this ozone protects us from ultraviolet rays. So the high level ozone, remember there was the hole in the ozone in the mid 1980s from the CFCs, the chlorofluorocarbons, and that caused a hole in the ozone layer over the South Pole, and there was the scientists were very worried about it, and we really dramatically decreased the amount of CFCs, and that helped quite a bit to decrease the ozone. So anyways, that is healthy ozone, that's protective ozone. So the dangerous ozone is ground level ozone. So again, the ground level ozone, and this occurs from pollutants, which is essentially fossil fuel emissions, and they react in the presence of heat and sunlight. So that's where heat comes in. So a hotter climate, you're going to get more of the ozone. And these fossil fuel emissions are from cars, refineries, oil and gas extraction, and from industry. This is the soot part. This is the PM 2.5, the particulate matter. And this pie chart shows in the Bay Area where the PM 2.5s come from. And so the major cause is refining and the burning of gas and diesel. So this is the refining, and then this is, some of these other ones are from cars and trucks and from marine vessels. Now, also, this says, wood combustion, and this is down quite a bit, but fires, unfortunately, have taken this place. So fires are a big part of PM 2.5, but really the refineries and fossil fuels are sort of the majority of where these PM 2.5s are coming from. Hotter temperatures cause greater ozone. 150 million people in the US, so that's almost half of our population, live in counties where there are unhealthy levels of ozone. And a hotter, drier climate causes more intense wildfires and increased PM 2.5 levels. The US experienced almost 2 billion more person days of exposure to high wildfire risk in the last 5 years as compared to the earlier part of the 2000s. And the hotter climate increases allergens, which are also particulate matter, and worsens air quality. So this is probably something that doesn't come as any surprise, but there's clear evidence of an association between wildfire smoke and respiratory health, and that asthma and COPD exacerbations are associated with higher wildfire smoke in pretty much every study that has been done. So a little bit less expected is the strong association between emergency room visits the day following heavy wildfire smoke density. So what this is showing is that this was the increase in risk the day after exposure to elevated PM 2.5 in the emergency room. So 12% all cardiovasculars, 42% heart attacks. So an increase in all of these respiratory and cardiovascular problems after exposure to wildfire, to the particulate matter. So on November 8th, 2018, the town of Paradise caught on fire. So my first patient in the office that morning happened to be a resident of Paradise. And he told me the story of what was going on in Paradise, and the fire had erupted early in the morning and was spreading over the area. And so I heard this before it had even hit the news channels. And he told me just how dramatic and fast moving that fire was. And he had just made it out ahead of time, ahead of the fire. And he thought if he hadn't had to leave his town so early to get the appointment, he may not have made it out. And he also predicted there were going to be a lot of lives lost in the fire, and unfortunately, he was correct in that. So a really chilling reality is set in since this fire, and it's that many of my patients are making decisions about when to have surgery based on fire season, because they want to be able to be mobile enough in order to evacuate. So that's just a consequence, something that I had never experienced before in my patients, but now this is a reality in California, something that we have to deal with. And this is really just in our lives, in the last few years of our lifetimes, where this has changed our entire environment. So I'm going to go over the science just a little bit, because I'm certainly not an expert in this, but how does air pollution affect our lungs? So this is how ozone, it alters the lung permeability, increases inflammatory mediators. The alveoli restrict air movement, and it decreases our lung function. So this causes asthma, COPD exacerbations, and children who are exposed to chronically to air pollution, they actually have reduced lung growth. They have smaller lungs, and they have quite dramatically increased rates of asthma and decreased lung function. And what about particulate matter? What are the effects on the lungs? So again, I'm not going to pretend I know this entire mechanism here, but it causes oxidative stress, vascular endothelial damage, and it exacerbates chronic inflammatory lung conditions and worsens asthma, COPD, and lung cancer. So both the ozone and the PM 2.5 have really tremendously adverse effects on the lungs. And we see that because looking at studies throughout the world, what this shows is that air pollution, this is sort of a map of the deaths attributable to ambient air pollution, throughout the world. This is the number of deaths per year. So air pollution kills twice as many people worldwide as do AIDS, tuberculosis, and malaria combined. This is the map from 2016, and I think the studies in the last few years, if they were taken into account, these shades would probably darken by 2 shades each. So there was a study that came out in 2018, and what this showed is that because of the particulate matter, that 9 million deaths annually are associated with PM 2.5 pollution, and another million from the bad ozone that I was talking about. In the United States, this study from the Lancet estimated that 58% of excess deaths in the United States are attributable to the use of fossil fuels, including 210, that's about 210,000 premature deaths in the United States, including 2,000 to 3,000 in the Bay Area. And it gets even a little bit more dramatic. This was a study that was released just in February. And what this showed is they were able to distinguish particulate matter from fossil fuel emissions versus other sources. And they found that the fossil fuel air pollution is responsible for more than 8 million deaths worldwide, which was about 18% of all deaths were from the particulate matter of fossil fuels. And this was double the previous estimate. And this sort of, calculates out in this study to 34,000 deaths in the California attributable to particulate matter from fossil fuels. Believe it or not, this has a silver lining in it, which is that China was cut its fossil fuel emissions in half between this time period, and look at the number of lives it saves: 1.5 million lives in China and 2.4 million worldwide. So the take-home message is that not all air pollution is preventable, but fossil fuel emissions are preventable, and we need to stop them because look what it can do to our world, both on the upside and on the downside. This was a study from the US Census Bureau, and this showed that disparities in pollution exposure across different demographic groups, and that African Americans exposed to higher levels of particulate matter are than whites. And it shows that here graphically, the amount of particulate matter that they're exposed to, and that people exposed to less pollution have higher earnings, again, from the Census Bureau. So let's move on to the effect of climate change on vector equality. I'm just gonna touch on this a little bit. So climate change alters how we relate to other species on Earth, and in many cases will increase our risk for infections. So as the planet heats up, animals migrate towards the poles or to higher elevations to get out of the heat, which means the animals are coming into contact with other animals and humans they normally wouldn't. And this creates an opportunity for pathogens to get into new hosts. And of course, this is probably exactly how COVID happened. This was a study that showed half of the species are on the move, that land species move an average of over 10 miles a decade, and marine species are moving 40 miles a decade. And they even found one species of landed cod that moved 125 miles in a single decade. So of course, these have really quite dramatic, influences on, on our wildlife and interacting with them, with each other, something that is changing so dramatically. Deforestation and other causes of habitat loss force animals to migrate and potentially contact other animals or people and share germs. So this is a nice headline: want to stop the next pandemic, start protecting wildlife habitats. So again, this is certainly how COVID happened. So mosquito-borne diseases, warm, wet, humid climates allow mosquitoes to expand their range and accelerate their life cycles, boosting their ability to carry diseases. So earlier springs that we're seeing and later falls and hotter months contribute to higher mosquito populations and greater chance of infection. So that's, that affects these are the sort of the most common mosquito-borne diseases. These we don't have to worry about as much here, but certainly Zika and West Nile virus we do in our area. In India, excessive monsoon rainfall and high humidity was identified as a major influence, expanding mosquito breeding and survival. Malaria epidemic increased about 5-fold in the year after an El Nino event. So you can really see the dramatic influence that climate change is having on vectors. This is that disease in the United States has tripled, which is what's showing infected from mosquitoes ticks and fleas have tripled in the last 13 years. There are some other examples in Russia and Sweden where really they're having dramatic influences, dramatic increases. This shows the amount of Lyme disease on the march and the increases over the last 15 years. There was just an article, you guys might have seen it, throughout a lot of the local papers that these Lyme disease ticks were found all over the beaches in Southern California for the first time. So let's move on to extreme weather events. Floods, extreme precipitation, and weather events are increasing in frequency and intensity. And so what are the effects of those, and especially those on health? So they contaminate freshwater supplies. They disrupt the supply of medical and health services. They have tremendous effects on infrastructure and home loss, disrupt food supplies, and they increase waterborne disease outbreaks. So this is sort of a summary slide, but this is exactly what happened in Texas a couple of months ago. All of these things were seen from this, blast of Arctic air that came through. The estimate was that at least 58 people died in this as a result of this, some of them from just trying to stay warm. So one way that they categorize weather disaster events is those that cost at least $1 billion in damage. In 2020, there were 22 such weather events just in that 1 year, the average being 7 events. So really dramatic increase in the number of these huge climate disasters. So damaged infrastructure, how does that affect healthcare? So it prevents safe, high quality medical care. There's damage to the buildings. There's downed electrical lines and telecommunication services, lack of clean water. Hospitals need to evacuate and relocate patients. Hospitals are sometimes out of operation for weeks or months. This is bad for all of us, for patients, doctors, all health providers, and communities. So Hurricane Maria struck Puerto Rico in 2017. 2 years later, after that, in the operating rooms I was working in, we were still experiencing shortages of materials because a lot of this infrastructure, a lot of this was made in Puerto Rico, including medications, pharmaceuticals, IV bags, and a lot of equipment in the operating room. And this year we've seen the same thing as a result of the pandemic. So again, we don't have to look very far afield to see healthcare disruptions. Santa Rosa Hospital had to close in October of 2017 for 17 days as a result of the fires, and again in November 2019. So this is happening all around us. And of course, no discussion of health impacts of climate change would be complete without mentioning health inequity. Health risks and the impacts of climate change disproportionately affect low-income communities and communities of color. I'm sure you guys all see that. Climate change worsens environmental conditions, especially air pollution, that most impact vulnerable communities, especially people living near industry and refineries. They have worse air. Those that have pre-existing health conditions, those that have poor quality housing, they can't stay warm, they can't stay cool, they can't stay dry, and outdoor workers. So this is an example. So we have 5 refineries along the San Pablo Bay. So I don't know if you can see in the background, this is a map of the Bay Area. So this is the San Pablo Bay. This is the Carquinez Straits. So there are 5 refineries in the Bay Area all along the Carquinez Straits here. And so this is a modeling of the particulate emissions, the PM 2.5 emissions from the Chevron refinery, which is in Richmond, and this refinery called the PBF refinery, which is in Martinez. And so these are the plumes of emissions, and they heavily affect the poorer communities in this part of the Bay Area. The studies show that Latinx communities are exposed to 1.5 times higher emissions, and Black communities are exposed to 2.6 times higher emissions than the general Bay Area population. Another example of health inequity is found in these studies on the association of air pollution and COVID mortality. So there are dozens of studies all across the US and Europe showed the exposure to hazardous air pollution, increased mortality from COVID. And of course, people of color and lower economic status are disproportionately affected. In the past year, due to COVID, it's estimated overall American life expectancy decreased by 1 year, but African American life expectancy decreased by 2.7 years. So I've covered some of the health impacts we're seeing from climate change. And so now I want to talk about using our medical and our healthcare voices to act on climate change to help preserve the planet and our patients' health. So again, I mentioned earlier, this is from 1990. So people have been talking about it, and our health communities and our journals have been talking about this for 30 years. So this was from the Annals of Internal Medicine, that in 1990, they're recommending to work to prevent global environmental change, and that's consistent with the social responsibility of physicians and other healthcare providers. This is from the Lancet. Unfortunately, it was another 20 years before the medical community really started to take a look in this. So the Lancet in 2009, they published a report in which they concluded climate change is the biggest global health threat of the 21st century. In the last 5 years, there's been an explosion of information about the health effects of climate crisis, and the Lancet is sort of leading the way, but there's lots of other organizations. This is from the New England Journal of Medicine in 2019. As physicians, we are morally bound to take a lead role in confronting climate change with the urgency that it demands. As trusted sources for health information, physicians can educate our colleagues, patients, and students about the health effects of climate change and the need for rapid reduction in fossil fuels. So the journals are talking about it. Well, what about our medical organizations? Here's the CMA policy. This is their policy that they've written down. So we should be communicating with our local, state, and national legislators about the need to take action on climate change. And the CMA encourages healthcare institutions to review and improve their carbon footprint. The AMA is similar. Climate changes will create conditions that affect public health with disproportionate impacts on vulnerable populations. They encourage physicians to be spokespersons for environmental stewardship. So that's our organizations are telling us that. So that's a lot of talk. So how about some action? What are we doing about this, or what can we do about this? What should we be doing about this? So many healthcare professionals have found that it's very influential to use our health voices. People listen to doctors, nurses, PAs, nurse practitioners, mayors, assembly members, board of supervisors listen to us about the health harms of pollution. There are 2 local medical groups that I'm involved with, and several non-medical groups. This is Climate Health Now. I referenced it a little bit early. This started with a global strike about 2 years ago. It's grown to about 500 members in California. Physicians for Social Responsibility, they've been around for over 50 years. They're a Nobel Prize winning group. They also have a chapter here in the Bay Area and one down in Southern California. So I'm active with both of those, and they are doing similar things. We work together very frequently. So as the CMA encourages, physicians can, and I believe should, engage in legislative advocacy and focus on protecting society's health and addressing climate change. And these are some of the ways that I've been involved, and we can all be involved. So at the city level, we're encouraging cities to pass bans on new construction using natural gas, and instead using electrification of everything, water heaters and stoves. And I'll get back to that in a little bit. But this technology is here and it's available, and it is so much safer and cleaner. On a county level, I live in Contra Costa County. They're proposing an new oil drilling near houses and a hospital in Brentwood. I presented to their Hazardous Materials Commission about the health hazards associated with oil extraction near population centers, and they really listened to what we had to say about that. So, and we're very concerned with the air quality in the Bay Area. So especially as the studies that I showed that particulate pollution has been identified as being so unhealthy, causing so many premature deaths throughout the world. So even when we aren't experiencing fires, the air quality in the Bay Area is really quite bad. So this is a list that the American Lung Association comes out with every year about air quality in metropolitan areas in the entire country. And the Bay Area, we're in the top 10, in fact, in the top 8 pretty much every year. This was in 2019. By ozone levels, we're number 8. By year-round particle pollution, we're number 5. And short-term particle pollution, we're number 3. And again, this is not affected. This is irrespective of the wildfires. And as I keep saying, people in low-income neighborhoods breathe even worse air because they are usually closer to the source of the bad air. So this was the picture that I showed a little bit earlier. And what's happening with this is that there's the Bay Area Air Quality Management District, we call it BACMed. They are considering a requirement to add technology to the refining process of these 2 refineries here. This is the one in Richmond and the one in Martinez. And what this new technology would do, it would limit the particulate matter coming from these refineries by up to 90%. Seems like this should be a no-brainer. BACMed is supposed to protect our air quality, but this has been a very big issue. And so we have really gotten very strongly involved, the 2 organizations and many environmental organizations, and we have spoken with different boards, with different people on the BACMed Commission. We've written letters encouraging them to adopt this new technology, which could decrease the particulate matter by the emissions by up to 90%. And that vote is actually coming up in the next 4 weeks. If anybody has questions or interested in that, please let me know. Hopefully you've heard about that, because that has really has been in the news on the radio and in the newspapers. I'm going to turn to Kern County for just a minute. This is the environmental injustice capital of California due to their method of oil extraction. They have the worst top 1% in air pollution, diesel pollution, asthma, drinking water contamination. They have 20% poverty rate, 50% Latinx population. So this county has issued 20,000 drilling permits over the last 5 years. And the Board of Supervisors actually just recently approved another 50,000 more wells. So this is what it looks like there. And this was another issue that we got involved with. We spoke at this Board of Supervisors meeting. We spoke out against permitting new wells. We told them how bad it was as far as air pollution and water quality for the local population. Unfortunately, they approved these wells. These new wells are going to leave that poor community polluted for generations to come. And this is something that we're doing on state level. One of the reasons that we are advocating for a ban so one of the things we're doing is we want to ban on what's called extreme oil extraction. So people have probably heard of fracking, but there's a lot of different ways that they try to access oil. Most of them involve huge amounts of water and chemicals. And so they are very harmful to the people in the area and to the environment. So we are strongly advocating to phase out these type of extreme extractions. And we also want a setback from oil drilling. So currently, as you can see by these pictures, you can have an oil rig right next to your home. You can have it probably in your yard, You might even be able to have one in your living room if you wanted. We are, I think, the only state that does not have a setback between oil drilling and homes, schools, hospitals, nursing homes. So we worked with State Senator Scott Wiener from San Francisco. We helped him write legislation about these two issues: decreasing, extreme oil extraction and setbacks from oil drilling. That legislation did not pass this year. We are still working on it. There are other things that we are helping him with and some other people. And then we're also worried about the just transition, jobs for formal refinery workers. We're working with some of the state and national representatives on that. This is another very local environmental issue. Just a few miles from here, in the poor neighborhoods of Oakland and Richmond, both are fighting coal export terminals to be built at these ports. There are hundreds of rail cars daily with coal that come from Utah, actually, to Oakland and Richmond. And they have these open containers of coal, and they go through the local neighborhoods in West Oakland and Richmond, and coal dust is extremely toxic. So members of the health professional groups have expressed our medical perspectives at city hearings in both cities. These terminals are being delayed. They haven't been canceled yet, but we have made some progress. So this is what I want to end with. So this has been a lot of doom and gloom, but actually what keeps us going, like in medicine, is the goal of having good outcomes for our patients. And likewise in climate change, we want good outcomes for our patients and for the world. So the thing is, we have solutions to stop climate change and improve our patients' health, and they're available now. Solar and wind power instead of oil and gas, electric cars and trucks, electrification of homes and cities. And this isn't just hyperbole. These are the solutions, and they're available now. They are cheaper and they are healthier. And I'll show you a couple of specific examples. So, and we've actually taken big initiatives like this in the past. So the Clean Air Act, which was introduced in 1970 and was revised in 1990. And it regulated 6 air pollutants. And this has remarkably cleaned our air and saved lives. As you can see from the charts, these are all the different chemicals, and it's really done a remarkable job. So this is what we have been able to do, but it takes a government mandate, and it takes political will from our politicians. And it's difficult because the fossil fuel companies have a lot of influence in Washington, D.C. and state houses, but this is what we need to do. And so similar to the Clean Air Act, so we need something similar, a massive program for electrification of everything using renewable energy. And this is a report from the Goldman School of Public Policy over at Berkeley. There's also a similar one that came out from Princeton. And what this shows is a program or what can happen if we electrify everything using renewable energy. So these graphs right here, I don't expect you to see all the details, but what it's showing is the price of electricity from solar declined this tremendous amount, 90% in these 10 years. And with wind, it has gone down remarkably also just in the past 10 years. So the price of electricity is now cheapest from renewables, and it continues to fall. And of course, it's so much cleaner from the renewables. So if we integrate this and just power from renewable energy between now and 2035. So this is what we see happens. So these are the drops in CO2 emissions, sulfur dioxide and nitrous oxide. This is, of course, CO2 is what causes global warming, the planet to heat up. Nitrous oxide, this is what causes ozone. This is the main cause of ozone. So if we go to renewable energy, you have 90% drop in all of these. Sorry, this is with a 90% clean grid. It nearly eliminates emissions from all of these fossil fuel and other chemicals that cause the air pollution and causes us to get sick. So this last square is sort of a close-up right here. So if we do that with the 90% clean energy, this avoids 85% premature deaths through 2050. And this is just from the sulfur dioxide and nitrous oxide. This isn't even taking into account the particulate matter. So again, with the clean energy, and we have that ability right now, it's really dramatic in saving lives, cleaning the environment. And actually, if you look at the monetary aspect, on the last slide, it said it saves $1.2 trillion. So I want to conclude with this, that what can we learn, the lessons from COVID for climate change? Early aggressive action saves lives. It's hard or impossible to make up for lost time. We need to listen to the scientific community. Our leaders must enact policies that protect us from future risk. International cooperation is key to delivering meaningful results. And it is critical to invest in health systems that provide equitable access to the most vulnerable in our societies. So there is a lot that we can do as health professionals and health providers to save our patients' health and save the health of our planet. We can have a big impact by becoming advocates for a clean and safe environment. There is a role for everyone. And this is, if you'd like to join us, this is my email. These are the organizations that I am involved with. So I am going to stop sharing my screen and take any questions.
I have a quick question. I'm just curious, well, first of all, I wanted to thank you for doing this. But I was also just curious about your thoughts on the role that corporations have on climate change. And, you know, I think oftentimes they play a critical role in where we're sort of at. And for various reasons, they're not like properly held accountable. So I'm just kind of curious as to your thoughts on that.
I can't agree with you more. And yes, that's the cause of all of this. I mean, the major cause is that they have denied climate change. They have tried to push the cause back on us, on citizens. So, and they have a lot of influence, and they have a lot of money, and they get back, so many hundreds of millions, if not billions, of dollars in credits from the government. So that is what I would say the primary way that many organizations are trying to fight climate change. So there's a few ways to do that. One is defunding these corporations and not putting your investments in them, trying to have a lot of other companies now. There's really a lot that is being done, and it's finally starting to have an effect on that. That companies, bigger companies are now getting a little bit more worried about their climate impact. I agree. I sort of can't agree with you more that big corporations, especially the energy companies, are really what have gotten us into this mess. And people are starting to hold them accountable. So there's a lot of ways that you can do that. Bill McKibben has a great organization that he's working with. 350.org is a great organization. I'm involved in a chapter. And they are trying to make them accountable, make the corporations accountable. So thanks for bringing that up. I tried to stay a little bit out of that politics in this because it's such a problem, but we're starting to make some influence. And by standing up for the climate, talking about it, telling other people about it, the more people who hear about it and realize what a problem that is, and it is really starting to have an influence.
I agree, and thank you, Yadel, for bringing that up. But also the energy is being made for us, right? We're the consumers who keep consuming, right? So I feel like consumer habits need to change, but definitely thank you for encouraging us with getting more involved with politics, because you're right, getting 1 billion people to care about this stuff is going to be impossible, but setting regulations that improve the health and quality and well-being of everybody is really kind of where the money is at. But also we forget, we're like, oh, it's your problem. And I do agree that they put a lot of it on us. They're like, oh, don't be litter bugs, you know, but we're going to make everything in a disposable container, but we don't have anything to do with it. So I agree there's a lot of like kind of smoke and they're trying to like change, but we are the consumers. We are the drivers. We buy this stuff in packaging. We, you know, so we could shop at our local farmers market. I mean, there's a lot of individual things to do, which again is not going to help it. I agree as fast, but there's also like the issue of drawing it down too. Like we have all this carbon in the atmosphere. So we stop emitting, great, but we still have massive amounts of carbon in the atmosphere. So there needs to be a massive drawdown. So I think that's, I mean, billions and billions of individual actions have gotten us here. I think billions of small actions can definitely be worthwhile in getting us out of here. But I thank you too. I had no idea that Oakland's air was so bad, or that the cold train was going through Oakland and Richmond. It's amazing how many things happen right in front of us that we don't see. So thank you very much for giving this talk. I really appreciate it. I wish more people would have come, but I'm glad we got the people we did. So thank you.
Yes, you're very welcome. I agree with everything you said. You know, some of the things we say, you know, we can't recycle we can't recycle ourselves out of the climate crisis, right? That's not going to be enough. Of course, individual action is very important, but these companies are still going to pollute until they are told you can't pollute anymore or you have to pay for it, right? Even if we all stop, you know, even if we all say, oh, we want cars with better mileage, you know, until the federal government does something about it, you know, that's how you have an influence. And they are having an influence, right? In California, and we're going to phase out internal combustion engines by 2035, right? And that's not because consumers are buying electric cars. That's because the government said, no, this is what you have to do because, you know, look at the environment, look at what's happening. But they need a lot more pressure from environmental groups. And that's one of the reasons that we're doing it. And this is all stuff, I mean, I've only been doing this for a couple of years. There have people who've been doing this for decades, and I take my hat off to them because this is a tough fight. You know, we have made some strides lately, and we really have. A couple of refineries in the area are shutting down. We really are, you know, are starting to have an influence on corporate America. And these people have been doing this for decades. And it takes, it takes relentless amount of energy, and every step of the way, you know, you have to put pressure on them to do the right thing, because they are not going to do it. That's not how capitalism, that's not how corporate America works. I mean, I don't want to get into that part, but you know, it takes a lot of influence all the time.
I want to jump in and thank you. And I think one of the key things that somebody pulled out in the comments is, you know, this has been sort of in the legal realm and the environmentalist realm, but really linking the health effects is huge. And providers with patient stories can have a huge impact in the legislature. I've done, you know, testimony in Sacramento before, not on this issue, on other things. And when people with white coats come and talk about health impacts, it really, really has an impact. So hats off to you, Dr. Mann, for doing it. And I'm hoping, you know, we can motivate some other people to join in. So it's great. I really appreciate your time.
Agree completely that the patient stories, I mean, they are very powerful.
Yeah.
Yes, agree with you.
I have a question. Well, before I have my question, I just want everyone to look into the chat box and find the evaluation. And everybody, even if you aren't getting CME, if you can just take the evaluation, that helps us with our CME data. We'd be really grateful for that. And before that, though, Dr. Mann, I do have a question. I know you were talking about people who work outside, and for so many of our patient population at our health centers, we have day laborers and other people who are working outside. And so what can you tell the providers on this call about how, you know, what can they talk to their patients about? I mean, these are the only jobs that are available to so many of our patients. And so how, you know, what are you all talking about on the back end about how to change the nature of our jobs, and What do we talk to and say to patients who have these jobs that are going to have to be outside during wildfire season or extreme heat conditions? And yeah.
You know, that's a tough one, because these are the jobs they have, and you know, the conditions are getting worse. I think that a lot of organizations are realizing that. There are a lot of organizations that we partner with, Communities for a Better Environment, CBE, and NRDC, National Resources Defense Council, who are working with, you know, frontline workers and in trying to protect them. And I'm not sure I have an answer other than if people don't feel like, you know, if the patients don't, you know, feel like they're getting listened to, or they are, you know, in harm's way, that they have to notify somebody, and we're, you know, a good person to notify. And you know, if we tell an agency that their workers are unsafe, I mean, I think they're much more likely to listen to that. So, you know, now we know about how important, you know, masks are. Hopefully people have some, you know, everybody has their N90, not everybody, but hopefully have N95 masks for particulate, you know, for the wildfire season. But yeah, I don't know, Jenna, that's a really tough one. But other than that, we have to be their advocates, you know, that's really important to do that.